Hello and welcome back to Life with Dr. Amanda. I'm Dr. Amanda and it's time for another Medicine Monday, where the aim is to educate, empower and equip you with the knowledge that you need to live your healthiest life. Today we're talking all about the menopause. As you can see, we're in a different setting today. Usually I'm at work in my doctor's office giving you all this information, but today we're in my kitchen at home, and the reason for that will become obvious as the video goes on, so just bear with me. But today we're talking all about the menopause. The menopause, it's not really a sexy topic, but it is a really important one. Half of the world's population is made up of women. And if as a woman you live until the average life expectancy, about a third of your life takes place after the menopause. It is a really big thing to go through, and so it's important that we speak about it. Even if you're a man or you've not quite gotten to the age yet where you're going through the menopause as a woman, it's still important to know the information so you know what to expect when the time comes, or as a man so that you understand the women in your life a little bit better. And it can actually improve your relationships as well. So let's start with the definition of the menopause. The menopause is the end of your childbearing or your fertile years. We define somebody as going through the menopause after they've had 12 consecutive months of no period. Now, before that stage is actually reached, it often does take a few months to actually get there. And those symptoms can often start with, a change to your periods. That might mean they're getting more heavy than usual, or they're getting lighter than usual, or they're becoming irregular. You might be missing a month or missing 2 months or 3 months, and then they come back regular for a few months at a time. Now that period is called the perimenopausal period, and the symptoms associated with going through menopause can start from then, and they can go on up until usually around a year after going through the menopause. But for some people, it can be longer than that or shorter than that. Now, the menopause usually on average happens between the age of 45 and 55. And in England, the average age is 51, I believe. But there are people at either end of the spectrum. Some people will still be having periods till just after 55, and some people may start before 45. But we don't usually need to have any blood tests or anything like that to diagnose someone going through the menopause. We can take into account their history and their age and the symptoms that they're going through, and it's usually quite an easy diagnosis to make. But there is a small percentage of people, of women, that go through the menopause even earlier, say before the age of 40. That will be known as premature menopause. And so in that case, it's not enough just to take a history and say this is the menopause. It's unusual, and that is when blood tests are usually needed. Now, the usual reason for going through the menopause is that there's a natural decline in the female reproductive hormones, which are progesterone and estrogen. But there are some other reasons that can push you into the menopause. Whether it's from a chemical point of view, that you've had some medications such as chemotherapy that have kind of switched off your ovaries to produce those hormones, or if you've had a surgery to remove the ovaries where the hormones come from. And so that can sometimes push people into menopause. And it's not natural that they've gone into it, but still the same symptoms and the same management options still apply here. And as the main culprit for going through the menopause is this decrease in hormones, that's actually the reason why we get so many symptoms. And the main hormone decrease that I want to discuss today is all about estrogen. Now, if we think about the role of estrogen, it can give us hints and clues to what kind of symptoms we may experience whilst going through the menopause. Now, estrogen isn't just there as a sex hormone. Yes, its primary job is to help us to go through puberty, help to regulate our cycle, but there are other functions to it. Estrogen actually helps to stabilize our mood. It helps to promote a hormone called serotonin, which is the mood balancing hormone. People have also done some research to show that estrogen actually helps the way in which the brain is structured and communicates. As well as that, estrogen also helps us to have strong bones. It helps with bone turnover and so prevents them from becoming thin and brittle. And also, estrogen actually is very useful for helping with our heart health. It helps to reduce inflammation and also manage our cholesterol levels. So if estrogen is decreasing all these functions that it has, you can imagine the impact that it has on our life. And this is where the reason why I'm in the kitchen becomes a little bit more obvious. I've done a bit of baking earlier today to help illustrate how estrogen plays a part in how our body works, and also to kind of give you a bit more of a visual representation of why it's so important and why what we do going forward once we go through the menopause and the estrogen decreases really has a lot of relevance to us. So I did some baking and I've made 3 cakes, as you can see over here. Now this first cake it represents a woman before the menopause. It's full of eggs, and if you imagine eggs as being estrogen. Now, as you can see here, this cake is nice and tall and it's bouncy and it's moist. It's a very simple recipe, but the eggs in it give it that really nice texture, that nice crumb, and it makes this enjoyable. What I did after I baked this cake was bake a cake where I used the exact same ingredients, but I took out the eggs. I took out the estrogen and I did nothing else, just took the estrogen out. And let me show you this cake. To be honest, I don't even know if I can call it a cake. It's dry, it's cracked, it's got no height to it, and it's really hard. This isn't something that is appetizing, and this cake represents a woman after the menopause. It's a crude representation and it can seem quite negative, but this is what happens if the eggs aren't in the cake and you do nothing about it. You do nothing to replace it, you make no changes. This is the kind of cake that we can get. Now this is the third cake that I made. Bear with me, I do enjoy baking, but I'm not a great vegan baker. And so this is a recipe that I found online that had some egg substitutes in it. And so it was a completely different recipe to that first cake. And because there was no eggs that was being used, we had to improvise, we had to use different things. And actually in this, I've used some coconut milk and some apple cider vinegar to act as the binding agent, I guess. And I've tried vegan cakes before. I know ones that are much better than this, but still look at this cake compared to the one with just no eggs in it. It actually feels moister than the first cake does. It's not got quite as much height, but it's moist, it smells good, and it looks pretty appetizing. This represents the woman after menopause, but the woman that hasn't just kept things exactly the same. That's done something about this lack of estrogen and is still, a really yummy cake. The reason I made those cakes is just to show you that going through the menopause is not the end of the world. It's not the end of your life. Like I said, 1/3 of most women's life happen after the menopause. It's actually a really exciting time. When you go through the menopause, when you're in your late 40s, early 50s, often you've got to that point where you're quite settled in your career perhaps, or you know what you want to do with life for a lot of people. You may have children, and those children are usually older, more at the teenage end of life, or even early adults. They're more independent, and yes, there are still struggles that come with that, but the nighttime wakings may have changed. Also, a lot of people, when they get to that point in life, maybe their relationships are more stable. Those changes and those, building blocks that those foundations that you're trying to put in your life when you're in your 20s and your 30s and even your 40s, once you get to the age of menopause, often things have settled down. And so I think it's beautiful that when you go through the menopause, your body starts saying, hello, you need to pay attention. And for the years previous to that, you often spend a lot of time, and as women it's really common to spend so much time looking after other people. But the menopause is a time in your life where it's time to look after yourself. And you really can still have a really fulfilled life. You can still be very comfortable. And also, the worry about bleeding every month and the worry about getting pregnant when you're not wanting to, all of that goes away. And so the menopause is a new phase of life, and it's time to look after you. So let's go through the different symptoms that are associated with the menopause and how we can treat them. So the first thing that most people think about when they hear the menopause is hot flushes, night sweats, and this causing sleep disturbance. Now, luckily, and I'm really glad to say that this actual symptom is something that does not last forever. Once you go through the menopause, most people have gotten rid of this symptom after 1 year. Some people it's a little bit longer, some people it's a little bit shorter, but it will stop. So there is hope. But when you're going through these hot flushes, a lot of the time we can do some very simple conservative treatment. So, for example, using a fan in the bedroom when you're going to sleep carrying a fan around with you when those hot flushes start to come on. Also, wearing very light clothing, light bedding can also help as well. In addition to that, the reason for these symptoms is because the estrogen is gone. And there are different ways to replace estrogen, and we will talk about the medical ways further along in the video, but you can also get estrogen from your diet. This is called phytoestrogen, which is a type of plant-based estrogen. It's not synthetic, it is natural, and there's less risks associated with having estrogen like that. And it can be found in products such as soy. So having soy or having soya products in your diet isn't right for everyone, but for the menopausal woman having hot flushes, a little more soy may be useful. Also, have a look at your triggers. Are you getting a hot flush every time you have a hot drink? Or is it after you have a spicy meal? Look at those triggers and, mitigate for them. Maybe cut out spicy meals, or if you really love them and really love your cup of tea, have it in front of a fan. There are lots of ways to treat it, and like I said, this one does stop. The next symptom is problems with your mood, your concentration, your memory, just feeling a bit more foggy up in the brain space. And people often, compare it to having baby brain after you've just had a baby as well. Now, in this time, we said before, estrogen helps to regulate the brain. And so it's not a surprise that sometimes you can start having these mind fogs. But this is just a moment for you to start looking after yourself. Go into things such as counselling if you find that your mood is really struggling, or taking some time to actually practice self-care is also another way to treat these things. But there's also things that you can do in your diet to promote brain health. And here is a list of things that you can actually add into your diet, such as whole grains, that can help. In addition to that as well, reducing down sugary meals and also processed foods can help to have better brain health. The next problem is an issue with your bones and your muscles. Estrogen is there to help you have stronger bones, and you can also find after you go through the menopause that you start having reduced muscle mass. When this happens, you can often complain of aches and pains, and this is a symptom that a lot of women don't often associate with the menopause. Have you found that suddenly you've gotten into your 50s or your late 40s and you're becoming a bit more creaky, more aches and pains everywhere? And you're thinking, is this arthritis? But maybe you're having x-rays done or you're having treatment and nothing is really showing as any issues. And it might be because this is related to the menopause. In addition to the aches and pains, if we don't look at our bone health, it can lead to a condition called osteoporosis, which is actually where your bone density is less than it should be. Osteoporosis doesn't have any symptoms, but it can lead to fractures from very minimal amounts of pressure. And that's why it's so important that we look after our bones. First of all, what we can do is exercise. Doing weight-bearing exercises, whether that's things where you're using your body weight, such as squatting and push-ups, or if it's using weights. And you know what, doing those exercises can make you really feel quite empowered as a woman, but doing those exercises often increase your muscle mass, and when it does that, it actually gives more structure to your bones and can help with all these bone problems. In addition, making sure you're getting enough vitamin D and calcium in your diet. And actually, for vitamin D, I suggest that everyone should be on a vitamin D supplement. If you're living in England, there is just not enough sunlight. And if you have dark skin like I do, you need to have vitamin D supplements all year round, no matter your age, and especially after you've gone through the menopause. Now, the next thing that can be affected by the menopause is your heart health. The way to look after it is by a good diet and also by exercising. I've said it before, but we recommend 150 minutes of exercise a week, and it's up to you how you split that up. Just remember, it should be moderate exercising, and it should incorporate some weight-bearing exercise as well. And by moderate, I mean you need to be breathless by the end of your exercise session. Here is also another list of foods that can help with your heart. The next thing is all about your skin and your hair. It's true, when you go through the menopause, the collagen, which is the elastic substance that's in your hair and skin, can decrease. And that can lead to wrinkles and your skin feeling very dry and dehydrated. The best way to treat this is moisture, moisture, moisture. You can get moisture in two ways. First of all, having a really good skin and hair routine where you're using lots of conditioning products and also creams on the skin and moisturizers, but also making sure you're hydrated by drinking enough water. Also remember that there's a lot of soaps that are quite drying to the skin. Don't use a bar of soap, use more of the liquids, and if you can find a moisturizing one, that's even better. And don't forget to always use sun protection. Even if you're in a dark skin complexion like I am, it's a complete myth that you don't need sunscreen. And so even on dull days like it is today, I still use sun protection, especially on my face. Now let's talk about weight gain. It's not inevitable. Often women go through menopause and they start putting on the pounds, and it can happen, but it doesn't have to. Now, gaining weight, it can happen if you start becoming less intentional, and it's all right if that does occur, as long as you do something about it. A good diet, exercise, especially like I said, those weight-bearing exercising, and swimming can be excellent too. So the next two issues that I want to speak about are all about the intimate area, your genitals, and I'm talking about the vagina here. The first one is vaginal dryness. Now, vaginal dryness is a really common issue for women after they've gone through the menopause. The vagina naturally produces discharge, which is a lubricant, a naturally occurring one. But as your hormones decrease, this can also decrease. And vaginal dryness can lead to lots of symptoms, itchiness and soreness, painful sex, and also lead to urine problems. So often your urine can start to burn, or you find yourself going to the toilet more frequently. These things can be mistaken for urine infections, and often, inappropriate antibiotics can be prescribed. But if you think maybe this is menopause and you've had a course of antibiotics and you're still complaining of these issues, we need to think, is this vaginal dryness? The way in which it's treated is mostly with lubrication. Lubrication. Now, lubrication can come in two forms. It can come in just simple gels that don't have any hormones in, and that can be used as liberally as you like to make sure that you're comfortable, and especially should be used before any kind of sexual intercourse to make sure it's still a pleasurable experience. But in addition to those lubricants that can be bought over the counter, there are also some that have some hormone inside of it, some estrogen, and this can come in a number of different ways. It can be given as a gel that you just put on topically, but a pessary or a ring can also be used. Now, people do start to worry when they're having things that have hormones inside of them, but the important thing to remember is that using these hormones just in the one area, in the vagina, can actually be quite safe. But using those topical kind of treatments for 12 months, actually the risk that's associated with that is like using HRT for one day. In addition to lubrication, the problems that are associated with the vagina, the itchiness, the dryness, and the urinary problems can be helped by doing pelvic floor exercises, also known as Kegels. Doing that regularly, and I say try to do it 3 times a day, 10 contractions, and on that last contraction, holding it for 10 seconds. If you're not sure what I'm talking about, have a search online. There are so many videos, there are so much resources all about pelvic floor exercises, but it's definitely something that you should be doing. And the second part of this is all about your sex life. Often people do complain that they go through menopause and their sex life starts to change. But when we really dig into it, often the problems with the sex life didn't suddenly occur once your period stopped. Now, over life, there can be, a lot of different events that happen. Raising children, relationships, just different stressors, financial issues, and that can always put a strain on our relationships, whether or not you're in a long-term one or not. And so sometimes, especially if you are in a long-term relationship, the romancing side of things can start to decrease. But us as women, we actually really need to be romanced. And the way in which our sexual arousal actually works is by having, good intimate relationships with people. And so when you've gone through the menopause and you think, oh no, my sex life was ruined because of all this vaginal dryness, yes, use your lubrication. Please, ladies, do use that. But also start talking with your partner again. It's time to reignite that flame. You might need to go to marriage counselling, or maybe it's just that you need a romantic getaway, or you need date nights, whatever it is to get that spark going again. Also, in addition to lubrication and also getting some romance into your relationship, it's important to talk about foreplay. I don't know if it's because of the age of women that go through this, or maybe it's issues with the partner, especially if it's a male partner, maybe struggling to maintain an erection for long enough. But there are a lot of women who come and speak to me about problems with their sex life. And actually I was speaking to one of my friends who works in obstetrics and gynecology, and she also said that women come to her, they talk about problems with their sex life, and when you go into it a little bit more, you find out there's no foreplay at all. And I don't know, if you imagine a cold winter's day, as it is right now for me, and your car's all frosted over, even though your car wants to drive, sometimes it needs to be warmed up. And so foreplay can make a massive difference to your relationship. Hopefully you don't have little kids anymore, and so you can spend a little bit more time being intimate together. In addition, if you're a single woman, or if you don't have a male partner, and you're using things like sex toys, remember to keep them clean as well, because there are cases of some women who are using sex toys, and even if you are in a relationship with a man as well, you may be using sex toys, but getting infections from them, which can cause issues with urine infections and all sorts of things down below. So make sure to keep it nice and clean. So those are the main symptoms of the menopause. There are some people that have, some slightly different symptoms. Everybody is an individual, but if you're at the age and your period is starting to mess up and you're really struggling, it may be time to, invest in yourself a little bit more. But you might be thinking, hold on, if all these symptoms, the problem is because I don't have enough estrogen, I don't have enough progesterone in my body, why don't I just replace it? Can't I just take a pill? And the answer is yes. There is something called hormone replacement therapy, or HRT, and I mentioned it a little bit earlier on. Now, the reason why I wanted to talk about all the other ways that you can treat the menopause and get through it still thriving is because HRT is only a very small part of the answer. It can't be used indefinitely, and there's some women that can't use it at all. And even if you're using HRT, all those other lifestyle changes that I spoke about, they also need to happen. But yes, HRT can be used, and HRT can come in a number of different forms. It can be used as a gel, a tablet, or a patch. Now, there are some risks that are associated with using HRT, and those include things like breast cancer, stroke, and clots. But actually exploring these risks, they're different for each woman. There may be some people that won't have any increased risk at all. And so I can't give you advice on whether you should have HRT or not, but it's definitely a discussion you should have with your doctor. Your risk associated with HRT is often a lot less if you are under the age of 60 and you start using it within the first year of having symptoms. Now, don't be afraid to use HRT. Yes, there are risks associated with it. Yes, it can be a bit of a controversial subject, but say you're doing all of these other lifestyle changes to help manage and you're still struggling, that isn't a problem, that isn't something to be ashamed about, and there is more help that's out there for you. But just so you know, there are some side effects that are associated with HRT. Not everybody will have these side effects, but they are something to be aware of. They include breast tenderness. Some people have some breakthrough bleeding, so some bleeding from the vagina with it. Some people have an allergic reaction, especially on the skin if you're using a patch, or might feel more nauseous with it. Also, it's been quite common to hear about people getting headaches or getting some leg pain, especially when they first start it. And in some people, they might experience some PMS type symptoms as well, but these things can be managed, and it's just something that's important to explore with your doctor. I really hope this video was useful. I hope that it's giving you a bit more information about the menopause, and that you're able to, if you're going through this, you realise that this is just a new phase of life and it can still be wonderful. Thank you so much for watching. If it was useful, please subscribe, like and share, and put any comments, questions or whatever down below. Until next time.